Approximately 49.5% of teens suffer from at least one mental health disorder. That equates to nearly 1 in 2 students struggling. Look to your left, then to your right. Someone next to you may be bearing this weight, and you wouldn't even know. Mental health is a prevalent topic in today's culture. With the global climate of unrest and the everyday pressures of school and work, it's easy to feel inundated with demands on our time and energy. Meeting deadlines, increasing the amount of social interaction, and fulfilling the obligations of daily life, to name a few. And our busy world does not accommodate these feelings. Nearly half of all Americans suffer from at least one undiagnosed mental health disorder, which becomes detrimental to our way of life if not properly acknowledged. Caring for our mental health is often stigmatized, which leads to internalized feelings of guilt and shame. Through a digital media course, we were given a year-long passion project to work on. We had an open choice of this project, and I wanted mine to counteract the stigma of self-care, knowing that a majority of the student body has been struggling with their mental health throughout the pandemic years. Initially, I'd planned on reaching out to students weekly, using either handouts with coping tips or activities to further my goal of educating students on mental health awareness. In talking to my peers, I realized that they were feeling bombarded with information. I realized flyers were impractical, expensive, and honestly, a waste of time. So I scrapped that idea and changed paths in order to scale my impact. Over the course of this project, I communicated with the student body in multiple ways. I surveyed a sample of students in November and found that over 86% were struggling with feelings of stress and anxiety, and over 80% were feeling burnt out. This is at a much higher rate than the national average. The results of this poll were not surprising. Over the past years especially, I've noticed my friends and classmates struggle with everyday tasks and school as a whole. This year, we had a podcasting assignment, my focus being mental health. Using a technique we learned about called Vox Pop, I surveyed a sample of students on their current mental well-being, stressors in their life, and coping mechanisms. The majority of students rated their mental health at about a 5 out of 10, with school being a common stressor in their life. The results were telling, and this was the final nudge that I needed to change paths and to try something new and different that would appeal to the student body in a big way. The introduction of therapy dogs on campus started as a daydream, an unattainable experience that wouldn't be effectively brought to life. I presented it to Dr. Graham, a new mental health specialist on staff at LNC, and we gathered resources about schools that had therapy dog visits, both locally and nationally. We use this as evidence of how beneficial this strategy is for student mental health. Interactions with a trained dog have been proven to lower blood pressure, help with pain management, promote self-esteem, and stimulate memory, as well as stimulate problem-solving skills. They also help people cope with tragedy, which, unfortunately, is surrounding us in greater amounts. Admin had quick approval of the idea, and from there, the dream rapidly became a reality. I contacted a nonprofit that specializes in finding therapy dogs, and I was immediately put into contact with volunteers in the greater Charlotte area who would be willing to visit with their dogs. Coordinating the dates was probably the hardest part of this entire experience. One of the most satisfying aspects was getting to see just how popular these events were. It took less than an hour for 50 spots to fill up, with students of all grade levels. This was not something that I had anticipated. This chain of events led me to open up a new session in between the original two. This filled up in half the time, which was unexpected. The first session was an anticlimactic one. The lady I'd reached out to guaranteed her time. After about 15 minutes of waiting, she did not show up, letting down 22 high school students that were promised this time. This occurrence, though, did show that there was excitement among the students and was an event that, if successful, would impact many students' lives. Luckily, the next 2 sessions went smoothly. I contacted a new volunteer and they brought their dogs, Max and Molly. The students loved this time to relax and pet the dogs, and I received incredible feedback on the execution by both students and staff. There's even been talk of continuing this series next year because of how popular the sessions were. This entire project has been a series of ups and downs over the course of the school year. Having little idea of my pathway, getting ideas and approvals, dealing with cancellations, and finally, watching this project take off successfully. It's been both hard on me and has given me a new sense of purpose within the LNC community. Introducing therapy dogs was my way of raising awareness of mental health, as well as bringing positive emotions to a building that many associate with negative ones. If there is anything that I want you to take away from this, it is that everyone struggles at some point, and that is okay. We all cope with mental health in our own way, and we should know and acknowledge that it is normal to struggle and that it will get better. You, as well as your feelings, are valid in this world.